Lumbar radiculopathy is an musculoskeletal disease. Look at this picture, shows that nerve compression, a lumbar spine. Look at this. Then X-ray findings. CT findings and MRI to identify nerve compression. Look at this. Detail going on. Introduction. Lumbar radiculopathy, commonly referred to as sciatica, is a condition caused by the compression or irritation of spinal nerve roots in the lumbar region. This condition can lead to pain, weakness, numbness, or tingling radiating from the lower back to the legs. It is a significant cause of disability and reduced quality of life, particularly in middle ages and older adults. Etymology. The term lumbar radiculopathy derives from Latin roots lumbar related to lower back and radiculopathy comes from radicula, little root, and paths, suffering or disease. Together it describes a condition involving nerve irritation or compression in the lower back, causing pain, other symptoms radiating along the nervous pathway. Definition. Lumbar radiculopathy is defined as the dysfunction of a lumbar spinal nerve root due to compression, inflammation, or injury, leading to neurological symptoms along the disruption of the affected nerve. Types. 1. Acute lumbar radiculopathy, sudden onset of symptoms, often due to trauma or herniated disc. 2. Chronic lumbar radiculopathy, persistent symptoms lasting more than 12 weeks, often associated with degenerative spinal conditions. 3. Mechanical radiculopathy, caused by physical compression such as herniated disc or bone spurs. 4. Non-mechanical radiculopathy, resulting from infection, tumors, or systemic diseases affecting nerve roots. Causes: 1. Herniated intervertebral discs. 2. Degenerative disc disease. 3. Spinal stenosis. 4. Spondylolisthesis. 5. Traumatic injury. 6. Inflammatory conditions such as ankylosis spondylitis. 7. Tumors or infection affecting the lumbar spine. Risk factors: 1. Aging. 2. Obesity. 3. Sedentary lifestyle. 4. Repetitive heavy lifting or twisting motions. 5. Smoking. 6. Genetic predisposition to degenerative spinal conditions. Complications: 1. Chronic pain. 2. Muscle weakness or atrophy. 3. Loss of reflexes. 4. Permanent nerve damage. 5. Reduced mobility and quality of life. Pathophysiology: lumbar radiculopathy occurs when spinal nerves roots in the lumbar spine are compressed or irritated. This compression may result from herniated disc, osteophytes, or other structural abnormalities. Compression leads to inflammation, impaired nerve conduction, and ischemia, which manifests as pain, numbness, or motor defects in the affected. Dermatal distribution: the pathophysiology of lumbar radiculopathy involves sequence of events affecting the lumbar nerve roots. First event: initial trigger. 2. Nerve root compression. 3. Inflammatory response. 4. Ischemia. 5. Demyelination and axonal injury. 6. Symptom manifestation: irritated or damaged nerve roots, general abnormal nerve signals causing radiating pain, tingling, numbness, or weakness along the distribution of the affected nerve. 7. Chronic changes: if unresolved, long standing compression and inflammation can lead to nerve fibrosis, reduced nerve functionality, and persistent symptoms even after the initial case is treated. Signs and symptoms: 1. Lower back pain radiating to buttock and leg. 2. Tingling or numbness in the leg or foot. 3. Muscle weakness in the lower extremities. 4. Sharp shooting pain exacerbated by movements such as bending or twisting. 5. Loss of reflex in the affected limb. Diagnosis: A. History and physical examination assessing pain characteristics, range of motion, and neurological deficits. B. Imaging studies. 1. MRI preferred for detecting nerve root compression. 2. CT scan useful for evaluating bone abnormalities. 3. X-ray to identify structural changes or fractures. C. Electro diagnostic tests, EMG, and now conduction studies to evaluate nerve function and pinpoint the affected nerve. Nursing diagnosis: 1. Acute pain related to nerve compression. 2. Impaired physical mobility related to pain and weakness. 3. Risk of impaired skin integrity due to reduced mobility. 4. Anxiety related to chronic pain and limited functioning. 5. Knowledge deficit regarding condition management. Then disease management. A. Conservative management. 1. Reset and activity modification. 2. Physical therapy for strengthening and flexibility. 3. Pain management with NSAIDs, acetaminophen, or muscle relaxants. 4. Epidural steroid injections for inflammation control. B. Surgical management: microdiscectomy or laminectomy for severe cases. 2. Spinal fusion for instability. Treatment options: 1. Pharmacological, analgesics, neuropathic pain agents such as gabapentin or pregabalin, anti-inflammatory medications. 2. Non-pharmacological, chiropractic care, acupuncture, heat or cold therapy. 3. Lifestyle modifications, weight management, regular exercise and ergonomic adjustments. Psychosocial medicine, providing emotional support and reassurance to encouraging participation in support groups. 3. Educating on stress management techniques such as mindfulness. 4. Developing comprehensive pain management plan with patient input. 5. Promoting social engagement and activity to reduce isolation. Prevention. 1. Regular exercise focusing on core strengthening. 2. Maintaining a healthy weight. 3. Using proper body mechanisms during lifting. 4. Avoiding prolonged sitting or improper posture. 5. Smoking cessation. In conclusion, lumbar radiculopathy is a prevalent condition that significantly impacts individuals' quality of life. Early diagnosis and effective management, including a combination of medical, physical, and psychosocial intervention, are essential to prevent complications and improve outcomes. Awareness and preventive measures can further reduce the incidence and severity of this debilitating condition. Thank you. Have a nice day.